Well, you may have noticed your healthcare provider offering acupuncture as a treatment, and you may be wondering, will it actually help me? We are joined by Professor and Chair of Primary Care at Kansas City University, Dr. Gautam Desai. He's going to break it down for us here. Thanks for being here, and good to see you, Dr. Desai.
Hey, it's my pleasure to see you.
So, I've had dry needling done on me before in the past, and I'm curious, what is the difference between acupuncture and dry needling?
Yeah, so acupuncture has been around probably over 3,000 years, and that's a creation from China. And dry needling is more of a Western invention, so a lot of sports medicine people, physical therapists will do dry needling. They both involve putting needles in. With acupuncture, you might add heat, electricity, or twirl the needle around. In dry needling, you might just peck it kind of up and down or just leave it there in the muscle.
What is acupuncture primarily used for?
Yeah, so some of the things that evidence has shown it's useful for is if you're getting chemotherapy, it really helps with the nausea and vomiting.
Oh, wow.
It can help prevent migraines. If you have osteoarthritis of the knee, it can help with that. If you have pain from a dental procedure, the evidence has shown it can be helpful for that as well.
Wow. And are there any risks to acupuncture?
You know, before in the 70s, before when people were not cleaning needles or they were reusing needles, there's a risk of bloodborne pathogens. But now, use a needle once, you throw it away, and if the person knows what they're doing, they're probably not going to poke you in an organ or a lung. So most of the time, sometimes people will feel like they're going to pass out or have a little bleeding or bruising. But it's not too much risk to that.
So if someone, say, doesn't have access to a doctor like yourself, are there other places where people can receive acupuncture?
Yeah,
that are reputable and all that,
Yeah, so there are different providers that do acupuncture. So sometimes physicians will do it, sometimes dentists will do it, and then people are sometimes trained at a college where they can learn to do acupuncture as well. So I would ask about certification, always ask for other patient reviews, and just make sure your main treatment is diagnosed by a physician. If you're having back pain, get checked out by a physician, then maybe do that in addition to the other therapy.
Now, let's take a look at some of the, you brought some instruments here for acupuncture, and I've volunteered here to be the patient. So let's show us a little bit about what what would it be like if they went and got some acupuncture. Okay,
so there's different lengths of needles based on the body part you're going to treat. So I'll just pick this medium length needle. And I've sterilized my hands, I have some gauze ready, and the needle's very, very small, so even if you're on blood thinners you can still get acupuncture. And I'm going to hold the tube here onto your thumb, and I'm just going to let it drop down and give it a little whack, and I'm going to just twirl it and advance the needle there. I don't know if the audience can see that.
Look at that. Here, I'll hold it up here.
All right.
There it is. I don't know if you can see that. Oh yeah, it's right there. Now, the location of the needle, that's, are you looking for a specific spot? Are you looking to hit something specifically in order to trigger or to reduce pain or something? Yeah,
there's about 365 acupoints, or places where you put the needle, but now that's expanded to over 2,000. So we might talk to you for an hour, or we might say, hey, you're having pain there. Let's put some needles around that area and add some electricity or something.
I love your segments, Dr. Desai. I always learn something from you, and you know what? I don't even mind being your pincushion, too. So.
Hey, I'm going to take it out at no extra charge to you, too.
Okay. Great to see you, Dr. Desai.
Very
Thank
nice
you so much.
You. Thank you.
Marcus?